when we look at this picture here, it gives us a sort of a visceral reaction to that person who's craving opioids, will do anything to get them, but really this is just one end of the spectrum. So we're concerned about addiction. We want to be compassionate and treat our patients for their suffering.
So addiction for the purpose of our pain patients would be a person who has lost control over the use of a substance, continues to use it despite harm with progressive degradation in function. What we're seeing as time has gone on and we have more evidence of the long-term effects of chronic opioid use, even in the patients that don't have overt addiction, is in the vast majority of cases, chronic opioid therapy is non-sustainable in the treatment of chronic non-malignant pain.
Even though an individual has been on a chronic, stable opioid regimen for years and not had any significant adverse outcome, their risk increases as they age.
Even in the face of evidence and what the physician would consider to be compassionate concern for the patient's well-being, the patients tend to be very resistant to tapering and discontinuing that class of medications. Chronic opioid therapy is, generally speaking, not sustainable in the non-malignant pain patient. And then strategies in working with the patient who is already on those medications to decrease and discontinue therapies that are harmful while encouraging other modalities that may be more sustainable and helpful for the patient.
So these opioid medications act on that part of the brain that had to do with survival. So when a person is in withdrawal or is concerned about going into withdrawal, it's a very primitive response that the limbic system has, that its survival is being threatened.
Any physician who has a license to prescribe controlled substances has to have already registered and signed up for the Cures database. Every time a physician writes for a prescription for a controlled substance, they have to go online and look at the database to make sure the patient is not receiving controlled substances from another provider.
So I'm going to stop right there and get into our case.
My question is, where do we go from here with this patient? Obviously, she's a drug seeker.
I think it's interesting in this particular case, really reinforcing the importance of the various care providers to be speaking among themselves to make sure that they're on the same page.
Thank you so much. That was very helpful.
It allows us to reach out. Location is no longer a barrier.